Atkinson, who's Director of Pastoral Care. You may recognize her. She's been at probably the last few, at least, talking about something that falls in our spirituality and healing program. And Tim Madison, who is one of the Faith Community Nursing Managers, will also be speaking. So, Margie.
Well, thank you, Eric. And again, it's always an honor to be here. And I want to introduce again to you Tim Madison, who's new to the Morton Plant Meese family as of January this year. And he's the manager for our pastoral care department and faith community nursing, which is what we're going to talk to you a little bit about today. And also on behalf of our palliative care program and our palliative care team, thank you so much for your support this past year. We're on pace for a record number of palliative care consults, which means a record number of people touched by that program. So thank you very much for that. So without further ado, we're asking for a grant this year to enhance our faith community nursing program. You may have heard me talk about faith community nursing in the past. We provide a partnership with our hospital systems, with our health system, and local faith communities, churches, synagogues, congregations in our community to provide health and wellness promotion. We provide training and materials to these. We are staffed by 3 part-time RNs. And we currently have 88 volunteer RNs in our Morton Plant Meese service area. And these are nurses who may have another job somewhere, but they're volunteering in their faith community to provide screening and education and wellness prevention to the members of their congregation. It's been a beautiful partnership over the years, and we've done much with this program, but we feel like we're poised to do more. He was just a normal man going to church one morning. He walked into the narthex of the church, and over here was the nurse, the church nurse, the faith community nurse, sitting there doing blood pressure screenings as people walked by. He thought he would walk up and get his blood pressure checked while he was there. And when he did, he found that his blood pressure was dangerously high. And the nurse immediately told him, "You need to go to the emergency room right now and get it checked." He did so, and you could say we've had many, many cases just like this where just a common blood pressure screen has found someone with a dangerously high health issue. We've referred them to the emergency room or to their doctor, and they've gotten the care they needed to prevent a dangerous event, a dangerous health event. And that's just some of the things that we do. We currently have 48 partner congregations in the communities we serve. I'm going to show you a slide in just a minute that's going to demonstrate the potential in our communities for this program to grow. So the focus of our grant is to provide a full-time coordinator to the current team. This coordinator is going to allow us to do a couple of things. We want to focus on growing some of our congregations in Pasco County. Right now, all of our staff is focused really right here in Pinellas County, largely in the Clearwater area. We want to expand that focus a little bit with this, and we feel like the climate is ripe for new partnerships in this area. We also want to focus on partnering with faith communities in our underserved areas. Our board of directors this year has a subcommittee. We have something called the Community Health Needs Assessment. And as a not-for-profit organization, we are really concerned about giving back to the community, in particular, underserved areas. So this person is going to allow us to focus more on recruiting RNs in areas that we have underserved needs, African American, Hispanic, low-income areas in our community that really don't get the prevention, the education, the screenings that you and I might get in our day-to-day life. So it's really going to be a focus on these underserved populations in both Pinellas and Pasco County. We're going to focus on education and wellness across the MPM system. And it may not sound like a lot to bring in one new person, but it's going to really hugely increase what we're able to do in the communities. The types of services we offer in community education and screenings. We'll have increased community contact and referral to Morton Plant Meats. Every year, we literally refer thousands of people back to our Morton Plant Meats facilities for health, for wellness, to physicians, many things. So it's a beautiful partnership for us as a health system. We also focus on reducing readmissions to our hospital. How do we do that? Our volunteer nurses in the community have partnered with our team to follow up with their parishioners who are discharged from the hospital who have a high risk of readmission. We work with our chaplain team. We identify patients who belong to one of these congregations. When they go home, with their permission, one of our volunteer nurses will make a phone call to them to just ensure that they've got the meds they need, they got the transportation to the doc, do they have the support they need. So this is just adding another layer of support, and not just that, it's someone they're going to know and trust because they already have a connection to them. Ultimately, this program impacts our community by giving us a healthier, better educated community. Oh, here we go. Pasco County, just to give you a perspective, Pasco County has a population of about 500,000 people. 13.7% of the people in Pasco County are living below the poverty level. We just today, Tim informed me, Tim just came back from a meeting with our nurse coordinators. We just today have 2 new churches who said we want to get in on this up in the Pasco service area. So there's opportunity. But how much opportunity? There are 306 faith communities in Pasco County. So this is a huge opportunity for us for growing our program. Growing our program, remember, means healthier communities, and also it puts people in touch with our facilities, which we believe provide the best care in the community. And in Pinellas County, just again to give you a perspective, we've got about 1 million people in Pinellas County. We've got over 13% of those people living below poverty level, and you can guarantee those people below the poverty level are not getting the health care they need. They're not getting the screenings. They're not being educated. We want to be really intentional about meeting those needs. And in Pinellas County, we actually have 724 faith communities. So to give you the idea, there's a lot of potential for this program. We need the manpower, I use that term loosely, but we need the manpower to be able to get out there and get more partners on board, to do more in the community. And with your help, we believe that this grant will enable us to do that. So, Tim, comments?
I wanted to give you an example of this. We spent the last Saturday in September at an Hispanic Seventh-day Adventist church here in the community, providing screenings and education. I had the most enjoyable job. I got to work with the children, teaching them how to sneeze into the pit of their elbow. And it was just a delight. The children are eager to learn. If you've ever been a teacher in the school system, you will appreciate them knowing where to direct their sneezes and how that impacts in a ripple effect so many people in our community. This is the kind of work we do and love to do. Thank you for listening.
Thank you.
And it goes without saying, after each presentation, if anybody has any questions, please don't hesitate to ask before you move on to the next one. Next up, I'm going to introduce Scott Anderson, who's going to tee up Dr. Ted Farrell. And if you have children in athletics or you just enjoy watching sports on TV, you can't help but notice so much conversation lately on concussion management, and we at Morton Plant Meese have our own concussion program, and that's what Scott Anderson and Dr. Ted Farrar are going to speak to.
Good afternoon. It's our privilege to be here in front of you. It takes me back to growing up. I grew up in a household with my mother and 4 sisters. So this looked like my dinner table, with the exception that we had 1 bathroom and 1 telephone. So things are different now. We're very, very honored to speak to you today on our concussion program. It's in my 45 years of sports medicine, one of the constant challenges is to continue to come up with ways to improve safety for the athletic population that we serve. And here at Baycare Morton Plant Meese, we service not only the school-based population of athletes, but also the recreational-based, and we try to address their needs. And obviously concussion management is a huge topic right now. We've been very involved for the last 4 to 5 years, trying to do things the right way, trying to do the best practices, studying that, and getting them out to the people in Pinellas County. I'd like to present 2 people that are here with me today. One is Marie Frudenthal. She's my athletic trainer at Clearwater High School. She's a tremendous mentor and has been very, very instrumental in helping me develop the concussion testing program for all the student athletes in Pinellas County that Dr. Farrar will talk about. Secondly, Dr. Ted Farrar. Dr. Farrar is the director of our Sports Medicine Fellowship Program through the Turley Center in conjunction with USF. He's also assistant director of the Family Medicine Practice Center over there and the head of our concussion program. So Dr. Farrar will present.
All right, thank you. I want to ask that the first grant that just talked, I really appreciate them teaching the children to cough into their elbows and sleeves, because as the spouse of a middle school teacher, I appreciate that she's not sick all the time because they learn their manners. Just wanted to briefly give you a little bit of the history on the concussion program. Literally, maybe in the last 6 to 10 years, a lot more discussion about the impact of concussion, mostly related to wonderfully embellished stories on ESPN about the long-term consequences of head injuries, and then people start to think, well, what happens to my little Jane or Johnny when they get a concussion, or 2 or 3? How does that affect them down the road? And so there was a need and an opportunity here at Morton Plant to try and see if we could do more and educate and treat concussed athletes better. So in 2011, myself and our former fellowship and residency program director traveled to Pittsburgh, Pennsylvania, which is the home of the IMPACT program, which is the preeminent software utilized in evaluating and managing concussed athletes. So we took a trip there to determine how they organize their program, how they use the software, how they treat their athletes, to see if we could emulate what was considered the gold standard in concussion management at the time, and still is. And what we found when we returned is that the Baycare health system had all the pieces in place, it's just that nobody knew about each other. So we began the process of pulling together a more collaborative team. That includes the primary care sports medicine physician, which is at this point myself, a handful of others that have graduated the fellowship. It includes our associate director and our 2 sports medicine fellows. Also includes a litany of athletic trainers who are platooned at various high schools that we're contracted with through Baycare. It includes vestibular therapists and physical therapists, which can help with certain types of concussion recovery. And it also includes a handful of neuropsychiatrists, 1, and I think there might be 3 in the county, so there's not very many, and we're lucky enough to have 1 inside the Baycare system. So with that team together, we started with a couple of schools later on in 2011, I think that's right. It was Clearwater and Osceola. We got a grant to perform the baseline impact test which those cost money. So we took, how many thousands?
We've got 3,000.
How many initially? Was it about 1,000?
Yes.
Yeah, about 1,000 athletes initially to kind of dry run the program to see if we could make the system work better. It seemed to work pretty well, and then when a contract came up with the Pinellas County School Board, we were able to show that we could expand the program to the 9 schools that we're contracted with. So this includes not only football, which is the one that people think of usually, but it includes women's sports, in particular soccer and cheer, also includes wrestling. There are concussions in other sports, of course, but those 4 are actually considered the highest prevalence to find that injury, so we decided to cover the 4 of those. And also, as we developed the program, we actually were more of a standard bearer on the state law, which was enacted for 2013. What was asked of athletes with concussions in 2013 was how we were treating them from the very beginning in 2011. And I was pretty proud of that fact, actually. And the program includes a carefully structured return to play. That's led by the physician. It includes the neurocognitive impact test that I mentioned briefly. Although we don't have to use that on every single athlete that has a concussion, it's an excellent tool to utilize in monitoring the progress of their recovery. We use medication when needed, but usually we don't. We use physical or vestibular therapy when necessary, but not every case needs it. And most importantly, in the last couple of years has been the development of return to classroom or academic accommodations. Certainly a concussive injury affects the brain. Typically we're talking about adolescent high school kids, and the first thing we do is send them back to school where the task is to improve their brain. And now they have an injury, so how do you manage that? So we have some very unique evidence-based things that we do to help manage their academic recovery. And then we get into what the athlete's mostly concerned about, which is playing, which is not really the first thing that you should worry about. It's the last thing you worry about. So with the continued support of the grant, we'd be able to maintain our best practice models that we started with emulating what they've done at Pittsburgh. We can continue evidence-based high-quality care, which is something that we want Baycare to be known for. We don't want to be known as the hospital system that randomly sticks athletes into programs that are not necessarily required in their recovery. We want to do the things that are correct and cost-effective and are in the best interest of the athlete. So with that, I'll let Scott Anderson, if you have anything else you want to add at that point. Thank you for your time.
Just real quickly, also with the advent of iPads and software tracking, we're able to manage our concussion a lot better as well. And year to date, we've had 202 reported injuries, 23 have been concussions. And as Dr. Farrar mentioned, it's the high-risk sports that we worry about most, but we also look at all the others. In fact, last year there were 4 swimming concussions. Those of you that have children or grandchildren swimming know that they swim in the same lane and things like that. So we look at all these sports, but the main thing is that we're doing it correctly, we're doing it ethically, and it's a collaborative effort that involves all of Baycare, and we're very proud of what we've done. Thank you.
You may also recognize our next speaker, Ellie, who is here to speak to the Indigent Funding Program. Ellie spoke about this program at last year's voting meeting, and the Women in Philanthropy Steering Committee felt very strongly about Women in Philanthropy possibly supporting this program again. So we've asked Ellie to come back and give us an update on the program and the need in the community.
Good morning, everyone. My name is Ellie Farrow, and this is Deja Rutledge. We both work in the case management department. Thanks for having us here today. We've come here, I think this is our 3rd year or 4th year, something like that, 3rd year. This is our 3rd year coming and talking with you guys about the indigent prescription program that we have here. We have had the indigent program now for several years within the health system. We have a PowerPoint slide we'll go ahead and go through with you all. I was going to talk a little bit about the purpose is basically to assist patients that are either underinsured or don't have insurance. And underinsured is basically those that have insurance but may not have prescription coverage to get their medications filled. Something on that line that they aren't able to meet that, whether the cost. But we work with, part of that purpose is also to reduce the readmissions. So if we're able to get that person their prescription filled, at least that start to get them to the next level for ongoing refills. Our hope is for them not to need to come back to the hospital to be readmitted. We also enhances them physically and emotionally, that they're feeling a little bit better, that they're able to get their medical needs met with hopes of feeling better and getting healthier. We work with community programs also to help with those prescriptions on getting those meds met also. Basically, the program works by either the nurse or the doctor or the social worker on the unit identifies those patients that need prescriptions upon discharge that don't have the funds or they don't have the insurance coverage that's going to fill their medications for them. So the social worker talks with them, kind of gets an idea of where they're at in their financial situation, their home environment. We look at other avenues to see if we have other funding sources, like a lot of the medication prescription companies will have a program, and we'll do the paperwork to get that filled for them also, if that's an avenue. We work with the Clearwater Free Clinic. That's one great collaborative that we work with a lot with, John, them helping us get prescriptions filled also. So we have quite a few avenues we work with before we turn to using the prescription, the grant program that we're asking for today. We're able to use the Baycare Pharmacy as getting a reduced cost versus the pharmacies out in the community. We just recently started that this past year, but using the Baycare Pharmacy. And there's a couple other ones in the community that we use also, like on the weekends for coverage on 7-day coverage there. We also assist with bus passes and taxis and wheelchair transport and those services for the patient that's being discharged that doesn't have access to be able to get home, or family members don't have vehicles, or they can't get to that doctor's appointment. So we try to make that easier little step. Again, our ultimate goal is to help them get the follow-up services that they need with hopes of getting them healthier to, again, prevent having them being readmitted into the hospital for not following through on something. Some benefits to the health system is, the big one is hospital days are saved by preventing that patient to either stay in the hospital longer than medically necessary or preventing them from being readmitted into the hospital. It also dramatically reduces the return to the emergency room. A lot of times once patients are feeling better, they just say, oh, I'm not going to fill my prescription because I don't have the money for it anyways. And we all know if you don't finish your prescription, good chance you're going to get sick, it's going to come back, and then you're back in the hospital again. So that definitely helps us a lot. Decreases the hospital admissions that as a result of inadequate outpatient rehab. The other thing is there's no overhead expenses. It's all done by the social workers that are already working here 7 days a week in the hospital setting. Benefits to the patient and the community, the patients will have a better ongoing treatment of care. Like when we know we're feeling better and we're progressing, we're following up with our primary care doctor, we're getting our prescriptions, we're taking it, we tend to feel better. Therefore, we're taking care of ourselves and we're feeling healthier. It also gives knowledge to the health system that there's help and linkage to the health system and the other community providers. We also help the patients be able to transition to other programs that are going to give them ongoing support, whether it's applying for Social Security Disability, applying for county social services assistance, other prescription assistance programs. The indigent program that we're talking about today, the grant, is basically to help that patient get a jump start on when they leave the hospital. They have their prescriptions, they're ready to go, it's filled, and then when they need refills, that's where the next step comes, that they're going to get help somewhere else. It's not, the refill part is not part of the grant. Okay. These are some feedbacks from our patients, and Deja was going to share with you guys just a recent experience she had with one of the patients that we worked quite closely with.
We had an amazing success story, which is, not that common for us, to be honest. But we had a homeless gentleman in our hospital. One of my social workers had developed a wonderful rapport with this gentleman. Can you not hear me in the back? I know. Is that any better? All right, thank you. But he was a homeless gentleman. He was probably in his mid-50s. My social worker discovered that he was highly educated. We're talking a Harvard graduate. He was an engineer in his previous life. Due to circumstances beyond his control, he ended up to be homeless. We accessed the prescription fund because he had extensive medication coverage needs. He also had wound care needs. So what we also did was we also placed him into an assisted living facility. He remained there for a couple of months. We just received a letter from that administrator of that assisted living facility saying how wonderful he is, how his couple of months stay in that assisted living facility, he has gained a job, he got a car, he's now saving up for an apartment that he's moving in with, and he's got a girlfriend. So it was wonderful. So that was our success story, and I wanted to share that with you. But I also wanted to say that with our prescription coverage fund, we do a case-by-case basis. And a lot of the programs that are out there that Ellie was referring to, like the Clearwater Free Clinic, the Pinellas Community Health Centers that we tap into, we use this fund to bridge those patients that don't have the prescription coverage before they are able to make that appointment. So we use this fund quite often, and especially for, like Ellie was saying, when the patients are in the hospital and for whatever reason their loved one cannot pick them up. Yes, we do the cabs, we do the ambulance if needed. So that was my success story.
Those are just some other feedbacks from our other family members, but here's a cost savings to the health system. This is just some estimates. I don't have exact dollars, but we did serve 786 patients. The cost of the prescriptions were close to $75,000. We also have on there 343 hospital days were saved. And that kind of goes back to what I was saying before, patients getting readmitted into the hospital because they didn't follow through on what they were needed to follow through on, completed their medications. Prevented 323 admissions and 289 emergency room visits. So we saved approximately $300,000 in unnecessary hospitalizations by discharging patients directly from the emergency rooms. The big difference is if we're able to identify that person in the emergency room, that's the piece that they need, then we can treat them and discharge them home with the assistance with the prescription program. It prevents them from having to be admitted and potentially staying several days before we make that transition. So in essence, it totally saves the health system approximately $900,000 cost savings after just deducting the money spent on the prescriptions and the transportation. So it's kind of the numbers speak for itself on just giving that little jump start to the family member or the patient on getting them transitioned into the home environment. Does anybody have any questions for us? Okay, thank you very much. I appreciate it.
Thank you. Next up is the Dr. George Morse Honors Your Loan program, which the community has helped fund for almost 15 years now. And our next speaker, Debbie Kovold, is going to talk about how the program is changing starting next year. And also Mary Cordes is here. She is a Honors Your Loan graduate who now is working in this building out of the new congestive heart function clinic. So, Deb.
Thank you. Thank you again for inviting us back, and I want to truly thank you for your previous donations and your philanthropy in helping our foundation and community. So I don't have any audiovisuals. I do have Mary. She's my audiovisual today, and I don't think anything's better than bringing somebody who's actually benefited from our program. So to give you a little idea, the Dr. George Morse Earnest Your Learn program started in about 1998, and actually we have had Earnest Your Learn in our organization for even longer than that because our hospital values education of our team members, which is a really, really great thing. I myself have benefited from advanced education through the generosity of our organization. So since 1998, I've got a cheat here, we've had 234 RNs we've put through school, 175 licensed practical nurses, 272 patient care technicians, and 11 nurses for their master's degree. So that is really an awesome feat for us to provide education to all these people. And, with education, there's a cost. We do pay for their books and tuition, and we have provided a stipend. And approximately $20,000 is necessary to put each nurse through nursing school, or I should say person through nursing school. And if you've been a patient in any of our facilities, I can almost guarantee you've been cared for by an Earn As You Learn nurse, because they're in every hospital on every unit of our organization. And even though they do sign a work agreement, they're highly dedicated, they're highly committed to working for us, since we have provided them a change in their life and their family's life to go on for many years to come. So the Earn As You Learn is changing in that it used to be that we provided a stipend for every person who was a nurse going to nursing school. And we kind of looked at that, and as you know, it is very expensive, and some of the people we've put through nursing school have come from families or a second career of which they have, had more funding and more ability financially than others. So we're looking at providing a need-based scholarship for those who can demonstrate financial needs. So there'll be an application, so it'll be a scholarship type program. The biggest gift for their Earn As You Learn is for them to get into nursing school. Last semester, St. Pete College GPA to get into RN school was 3.78. And as you can imagine, that's a pretty high GPA. And not that we're not looking to make sure nurses are smart, but we're also looking to make sure that the nurse caring for our patients has compassion, and they're in nursing for a reason. And I don't believe a 3.78 GPA determines what a good nurse is. So our ability to be able to choose those who will best care for our patients, along with the decent GPA, because we do want smart nurses, to provide care for our patients is the biggest gift to be able to get into Earn As You Learn. And so without further ado, I'm going to introduce you to Mary Curtis, and she does have a very high GPA. Mary's going to talk to you a little bit about what Earn As You Learn has meant to her and her education, and a little bit about the congestive heart failure clinic, of which now she is in charge of after she has gotten her advanced degree through Earn As You Learn. Mary?
Thank you, Debbie.
You're welcome.
And thank you for having me. This is such a great opportunity to thank you for the benefits that I've received from you, and to thank you for all the others that have come before me and after me, to have this wonderful opportunity to advance my education and to provide better care for my patients here at BayCare. I started at BayCare 9 years ago as associate degree RN, a new RN, and I worked on a stroke unit for 8 years. And during that time, I worked full-time, and I had benefits of tuition reimbursement, and I was able to get my bachelor's degree in nursing, and that was fully paid for by the tuition reimbursement. However, when I went to get an advanced degree, I wanted to get out of the hospital a little bit, still do patient care, but advance my education. And I'm not young like a lot of the girls that come into this program. They're just starting their lives. I'm a little further along than that. But to go to the advanced level in a graduate program, we have a small amount of money available. It did not cover but one class a semester. So I started with that, and I was gonna maybe eventually someday down the road get my master's degree. My mother kept asking me every semester, when are you gonna be finished? I have no idea, because I don't know how long it's gonna take at this rate. So then along came Earn As You Learn for a nurse practitioner. It was the first time it was ever offered. And Debbie Covert, being a wonderful mentor and guide through this application process, which was very rigorous, and we made it through it together, and I became the first candidate for a nurse practitioner with the Earn As You Learn program. And it really turned up the volume for me. I was able to continue my work full-time. I got a stipend, so I was able to decrease my workload by a little bit, and they paid all my tuition and books. And the biggest bonus is I get to continue working for BayCare for 3 years as my obligation to the company. But we had a little kind of barrier. There were no jobs available for nurse practitioners. So Debbie and I stepped out in faith, saying, now down the road when you finish your degree, which took me another almost 3 years, we're going to find you a job. And I actually got the job before I even graduated or had my certification. And I work right here in this building. I invite you to come over to the clinic. It's a heart failure clinic. And what that means to the system is, first of all, heart failure is the #1 admission to the hospital, and it's the #1 readmission. So we want to do better as a system with these patients for heart failure. And what's worked across the country is these little clinics, outpatient clinics, where we can see patients right after they get discharged from the hospital. We see them within 3 to 5 days, and we talk to them about their disease. We talk to them about their diet. We talk to them about their medication. They see a nurse practitioner. This is a whole new process for Bay Care, having a nurse practitioner-led clinic. So I'm very proud of that, and very proud that I could benefit the company in this way through my Earn As You Learn scholarship. So our sole purpose is to reduce readmissions in the hospital, help these people to stay home, have a little bit of quality of life. And we just opened in June, and we have had such beautiful success with these people. And, not everybody recovers well from heart failure. It's got a very high mortality rate. But we strive to give them quality of life. We work with the faith community nurses. We work with palliative care. We work with hospice. And I have a beautiful team of physicians that help me and coach me. And I want to thank you again for all of your support, and I hope you continue to support Earn As You Learn, because I see the many nurses that I've worked with and that are coming after me that have been through the program, and it's just a wonderful, life-changing benefit to working here at MEAS. So thank you, and please, if you'd like to, walk right straight back over there behind the lab. We don't have any patients today, so you can see the clinic and talk further if you'd like. Thank you.
Yes.
For these ladies?
Yes.
Does the Earn and Learn also go into the East Dunedin and
Yes,
Countryside?
Countryside and North Bay.
And where do they go since the St. Pete College grade point average is so high? Where do they go for their training?
They go usually Countryside, Dunedin, and Morton Plant.
To get their training?
They go to St. Pete College. They go to St. Pete College.
They do go to St.
School.
Pete College.
Yeah, their clinicals are at our hospitals.
Even though that grade point average is high, it works.
Across the nation, it's a very competitive area right now.
Okay.
Nursing.
Thank you.
You're welcome. Any other questions? I'm sorry, I should have asked. Anything for Mary? All right, thank you.
Thank you. And the congestive heart failure clinic that Mary was speaking to, that she works right there, is something that the foundation has supported the last year and a half through gifts from the community as well. Next up is Jean Marie, who's going to be speaking about the POWER program. While the request is relatively small compared to the others, it would be hard-pressed to find another program that would have the most impact of those gifts. So I'm going to introduce Jean Marie. I walk out, buddy.
Yes. Hello. Can you hear me in the back? Okay, good. Well, thank you for allowing me to come and talk to you today. And I think everyone who is here asking today has some fabulous programs that they're involved with. And I know with the concussion, I have kids at Osceola, so all of them are very impressive. But I'm here to talk about the POWER program, which is the program of wellness, empowerment, and recovery for women with breast cancer. And it's a program that we've had on the Morton Plant campus for the last 5 years. And it's an interdisciplinary approach to taking care of women with breast cancer. So it incorporates the physicians, physical therapy, wellness, dietitians, and the social services and the support services group. And it's that continuum of care so that we're touching that woman in every aspect of her life to help her to get through this difficult time and come out the other side stronger and better and capable to deal with what she's just gone through. As I said, we've been doing it here at the Morton Plant campus for the last 5 years. Recently, I have been working to expand it so that we can take it further out into our Bay Care facilities. We have 2 other wellness centers which we can tap into the wellness portion at our Palm Harbor location, at our Carillon location. I recently was able to secure a grant from St. Anthony's Hospital in order to cover the St. Anthony's portion of it in our Carillon Center, so we're going to be expanding there. And we've been beginning to expand it to the Palm Harbor facility so that we can reach women in a larger demographic area. It's a fabulous program, and we have had a couple hundred women who have come through the program. Not all of them stay through the whole program, but we have a lot of chances to make an impact on their lives, whether it might just be to lead them to the social workers so that they have someone to talk to, or to the chaplain so that they have people to talk to, or a dietitian who can work with survivorship nutrition so that when they're dealing with their chemotherapy and their radiation, that they're able to kind of work through this program. We've had a lot of women who have come to us a couple of years after they have finished their treatment and still are having some issues that they're wanting to deal with, and we bring them into the program. The program is set up for the wellness portion that they meet in a small group. We like to have 2 to 4 women. One woman is not, we do that if need be, but it's nice to have the camaraderie of a couple of women involved. That way they can kind of share the stories of what's going on. One day I had a group of women and they're all showing me their scars for their ports. They're all pulling down because Dr. Allen does a vertical incision where some of the other doctors do a horizontal incision, and they were showing their different their scars to each other, and they were talking about, you know, what medication that they were on, and now my fingers are numb, do your fingers get numb? So it's a great chance for them to talk to someone who's going through the same program. The other thing we do is we stop treating them basically just as a breast. And I know we have all these wonderful things going on this month about Save the Tatas and all of that, but for such a long time when a woman is diagnosed with breast cancer, that's all she's thought of. So with this program, we kind of get the body reincorporated again. We kind of teach them how our body works together. We kind of help them to get that range of motion, yes, back in their surgical site, but get their whole body to feel better again so that they can start taking control of their life back. The neat thing about it is it's shown that in the research that if you can begin an exercise program and continue, that you can reduce your chance of a secondary cancer by almost 40%, which is a very significant number. So we really are trying to get women who weren't exercising to start exercising and to be moving and to feel good about themselves again, and to get women who might have been exercising before and are going through this to get their body back again and have someone that they can talk to so they don't feel like they're all alone and that they can get on the road to recovery. And I want to thank you so much. I'm going to leave little guest passes as thank yous to all of you. If anyone is not a member of the Wellness Center, they can come for a week free, or if you are a member, there's a $5 off for personal training or massage. And just thank you for all the wonderful things you do for our community, because it's because of women like you that so many things happen. Thank you.
Thanks, Jean Marie. I love her passion. I also am jealous of the fact that she gets to wear comfy workout clothes to work every day. So honestly, maybe we can incorporate that. Next up is Zach, who's going to be talking about the partnership that we have with the Homeless Emergency Project. Each year, we support 8 to 10 different not-for-profits in our community that share the same mission of improving the health of our community. And I can't say enough good things about what Homeless Emergency Project does each year. We fund a medical overlay team through Morton Plant Hospital at HEP, and Zach is going to speak a little to that.
Good afternoon. My name is Zach White. As Eric stated, I'm the Director of Housing and Programs for the Homeless Emergency Project here in Clearwater. Typically, they say when you're nervous in a public speaking to picture everyone in their underwear. I'm not sure that's entirely appropriate for today's venue, but you know, you women feel the love in our hearts and the warmth in our souls. So, on behalf of HEP, I sincerely thank you for allowing us the opportunity to be here today and speak to you today about our program. So, Morton Plant Outreach Team. Got a little slide here. Won't be too long, but basically, this is a breakdown of what we at the Homeless Emergency Project deal with every day. We're nearly 50 million Americans are uninsured this year. 3.5 million Americans will experience homelessness. Over 22,000 people in Pinellas County experienced homelessness last year. And that's a growing number that we know from our statistics. Many individuals who are homeless also have mental health disorders and serious disabilities. They have gone untreated due to lack of access to behavioral and physical health services. This is sort of a breakdown of a lot of the issues that we see here coming through the program, be it families, individuals. Clearly, the majority of the barriers that we're seeing are medical issues that are contributing to them and their current situations. A lot of it has to do with mental health and substance abuse as well, and typically these are very intertwined as we see. But you know, having the Morton Plant team at HEP helps us address these issues and pave a clinical runway that we as a homeless provider could not do without their assistance. We simply could not have the significant impact that we do. The growing number of older adults at HEP is a concern due to the increased vulnerability of this population. Over the 1,300, almost 1,400 unduplicated clients housed at HEP last year, 35% were between the ages of 55 and 61, and 15% were over the age of 62. Most of these clients are uninsured. They're currently awaiting claims through Social Security or county health benefits or whatnot. Many of these individuals, for many reasons, aren't able to obtain insurance. The number of beds at HEP has increased from 120 to almost 400 beds in the past decade. And if anyone knows Barbara Green, I think those numbers are bound to increase in the coming years. The mission of HEP is to provide homeless individuals and families with housing, food, clothing, support services necessary to obtain self-sufficiency and improve quality of life. The mission of Morton Plant Meese Healthcare is to improve the health of all we serve through community-owned healthcare standards at the standard for high-quality, compassionate care. Our goals are very much aligned, and the partnership historically has been a significant one. And it's something that we hope to continue for years and years. But you know, looking at this collaborative approach, it's the integration of services to strike at the core factors contributing to homelessness. It's providing a seamless system of care that combines housing with physical and behavioral health and social service supports shown to provide lasting healthcare gains to end homelessness. We're looking to enhance the quality and access to medical and mental health care, resulting in fewer admissions to ERs, inpatient psych units, and hospitals. And I'd say we're doing a really good job. Looking to improve the quality of life of homeless men and women and their children throughout this county, throughout this continuum. This partnership with the Morton Plant Meese Foundation was formed in 1999 in response to the growing number of sheltered individuals with these types of issues that we're talking about, and the lack of health care that follows these issues that we're seeing with these folks. The MPH outreach team at HEP consists of an ARNP and 2 LPNs. Their sole focus on crisis intervention, stabilization, and health care management. I've got to tell you that the 2 LPNs that we have are just nonstop with their compassion, their care, their knowledge, their ability to treat and assist all the myriad of issues that come up with the residents that we serve. Our on-site medical care allows residents to experience longer periods of stability in housing, reducing incidents that may lead to injury, hospitalization, or much worse. It's an innovative program. It's an innovative collaboration. There's nothing like it as far as we know. There's nothing like it in our continuum. And for those of you that are familiar, and if you're not familiar with the Homeless Emergency Project, we are the largest, most comprehensive homeless provider. And you know, that's the significance that's needed to address these issues. And just having this staff here, I can't tell you. I mean, we're looking at just the greatest team ever under the roof. Some of the core functions, and I'll just run through these quickly. I know we're a little pressed for time, but we're assessing them constantly. Part of our intake process ensures that these individuals are going to have a medical screen by that staff upon intake within the first 72 hours of intake. Typically, it's within the first 24 hours. We're doing crisis intervention, first aid, providing over-the-counter meds that they might not otherwise be able to afford or access. We're assisting with treatment that individuals are unable to manage themselves, diabetes and these chronic conditions that need constant maintenance. We're doing a lot of drug and alcohol screenings. We're relying on them for liaising in the community for appropriate medical supports and services. We're monitoring vital signs. We're educating on health topics, instructing healthcare management, therapy, making sure that we get all their entitlements in the community and that they have what they need to sustain an ideal, optimal health. Daily monitoring of high-risk clients that are within the program, documentation for disability claims. All of these things amount to such a huge impact for these individuals. 40 HEP patients seen daily by this team. So 2 nurses. That's an average. I mean, they're literally clients waiting for the doors to open in the morning, and they're in the office till the doors close at night. And these staff, they become more than medical personnel for a lot of our clients. They become a support network to these people that they tend to rely on, and they sustain themselves positively because of it. Over the past 15 years, this team has treated over 12,000 people at HEP alone. 80% of non-veteran patients are referred to mobile medical unit or medical care and prescription assistance. A lot of times these things take weeks to address. Our team's able to link them in the community to get their needs addressed much faster a lot of times. 50% of those individuals who are in need of behavioral health care receive a referral to Directions Mental Health. Similar scenario. A lot of times we're waiting, but a lot of times we're able to address things in-house that really cut that time down. Number of patient intakes last year, 755. Number of patient contacts is over 6,000. The value of these intakes and patient contacts is just under $2 million. That's the impact that this partnership has in 1 year, saving this healthcare system that amount of money by eliminated hospital visits, ER visits, just by having these staff on site to help with med management, help with initial questions, help with these emergency type situations. I could go on all day about what a great team this is and what a huge impact it has for not only HEP's model, but for the population we serve. 68%, this is last year's data, 68% of emergency shelter guests were discharged to transitional permanent housing, meaning they have secured and maintained a much better housing situation than when they came to us. 73% of those individuals that went into our transitional housing program moved to permanent housing. 86% of permanent supportive housing clients moved to other permanent housing in the community. And so essentially, less than 12% of our clients, to our knowledge, return to homelessness. I contribute this largely to the significant impact and the partnerships that we've sustained at HEP with Baycare, with Morton Plant. Just simply wouldn't be the same place without it. So I'd like to thank you again, and I'll leave you with a quote, a Brazilian proverb. When we dream alone, it's only a dream. When we dream together, it's no longer a dream, but the beginning of a reality. And thank you again. Are there any questions? Yes.
I have one. Is there going to be some kind of collaboration between the homeless emergency program and Pathways? Yes.
Eric, that's a great, no, I'm just kidding. That's a great question. And my answer is, I hope so. I hope so. Yes, ma'am. How many employees do we have? We have just under 60 employees currently. Yes, ma'am.
Where is this located?
This is located right in the Greenwood area of Clearwater, just a few miles from here. It's on Betty Lane, right behind Everybody's Tabernacle Church. You can't miss it if you're driving down that road or the big 2-story copper-colored building. So thank you for your time again.
Last but not least is the totally indigent diabetic program. Our last speaker is Maria, not Debbie. I want to personally thank Maria. Debbie had a conflict that arose this morning, and Maria is pitch hitting at the 11th hour, so I greatly appreciate you being here. This is a program that Women in Philanthropy helped launch a few years ago, and Maria is going to speak about how the program has been progressing over the past few years.
Hello, so I'm Maria Marquez. I am the social worker at Turley Family Health Center, and I do have a couple of notes on my phone, so if I do look down, I apologize. I am sort of putting it together. But, sure. Can you hear me better? No. No? Better? Yes. Okay. So I'm Maria, the social worker at Turley Family Health Center, and basically the indigent diabetic aftercare program started in 2009, and it's to help patients that are discharged from Morton Plant Hospital that don't have any insurance and don't have any funding for medications, supplies, or follow up with their physicians. So through the program, we are able to give them just that. We're able to get to ensure that they have consistent follow up with physicians, to reduce the inpatient readmission rate and improve the patient's diabetic markers. So what happens is they come in through the hospital, through the emergency room, they are identified, and they are then referred to the Turley. We are able to provide them with physician visits. We bridge them for about 1 year to 2 years by giving them diabetes medications, supplies, which they'll need glucometers, syringes, lancets, alcohol swabs. We also provide case management to ensure that any barriers that they're having, such as transportation or additional medications that they might need, we supply them with that as well. We give them education classes. We have a nutritionist that provides a 4-week series diabetic class for patients that's open to them if they want to pursue that. We have, let's see, gosh, I feel like I'm dragging on here, but the average annual outpatient visit cost is about $52,000. The average cost of the medications and the supplies are $35,000. And we provide their labs as well and their testings, which is an average of about $10,000. The total cost is $97,000 for the year. Right now we have a limit of 70 patients. We have been staying between 60 to 65 patients per month. And that is for the first, we do try to bridge them, like I said, for a year after they're discharged from the hospital. I'm trying to think. More so than numbers, as a social worker, I can tell you that the benefit that these patients have through this program is beyond anything that they could ever receive elsewhere. There's programs for pharmaceutical companies, but they don't provide the case management, they don't provide the education, they don't provide probably one of the most important aspects, which is the physician care. So the benefit that they have is just, with diabetes, they are sometimes not able to go to work, they don't have the management, and it's just amazing to see them come from the hospital into our clinic, be given so much support, and to see that change it has in their lives. They're often very grateful. They are involved in their care. They partner with us
great, and so we just hope to continue that support. Thank you.